Your doctor has ordered the Doctor's Data Comprehensive Stool Analysis. You'll see the contents of the kit outlined here on the table. What we will first start to address is the test requisition form. You'll see a couple different boxes here paying special attention to the highlighted areas. Box number 1 says what the test kit will be billed to. It should say physician's account. You will pay for this test kit at the time of service. We do not accept insurance for payment for this test kit here. We will have marked the comprehensive stool analysis box, the date the sample was collected. This is where you will fill out this section here when you do end up collecting that sample. Box number 2 may or may not be filled out. It is okay if it's not filled out and it is blank. That will not affect the company's ability to complete that test kit for you. Box number 4, this is where we do ask patients if this is left blank to complete this section with all of their information in nice legible handwriting, making sure that your name, your address. If the sample is being prepared for a minor under 18, then the parent's information will be in the responsible party. The kid's information will be for the patient name, and then signing here indicating that you have read and understood the responsibility statement here. Box number 5 indicates who is paying for the test kit. They will charge us because, like I said, you will have paid for the test kit at the time of service, so the physician box will be marked. And like we mentioned, there's no insurance that we submit for payment here. I'll draw your attention next to some of the components here. There is a really great outline for how to prepare for this test kit here. Importantly, to avoid any probiotics for 2 weeks prior. If you're on any antibiotics or antifungals, making sure that you had completed that first and then wait 3 days at least before collecting this sample. And then there's some other things to avoid from using as well, like digestive enzymes, laxatives, particularly anything that has castor oil or mineral oil in it, antacids, aspirin, or other things with barium or bismuth, for example, for at least 2 days prior to collection. So make sure that you get a good read through that to make sure what you need to do in order to prepare, verify the test components that are included within your packet, and then there's just some additional information as far as, if there's any issues with the vial, to contact the company. But I will go through those as we start to discuss how to collect this. So the day that you decide to collect, what you'll do is you'll put this ice bag into the freezer to make sure that it's nice and frozen solid. When you are ready to have your bowel movement, you will first urinate completely into the toilet, because any either urine or toilet water components within or contamination within the stool will make the specimen not able to be tested, because it'll be contaminated at that point. So it's important to only have stool in these vials. So you'll have your full urine, and then you'll line this up in order to collect that stool sample. It's okay if the stool is looking more watery than you're used to, or whatever the case might be. You'll just collect your stool into this boat here. There are 2 different vials in order to collect this sample. So you'll have your stool in here. You'll put on the gloves. You'll then first take this yellow top vial here. You'll tap down on the vial to make sure that all the liquid has dropped into the vial. If you've noticed that this liquid is anything below that midpoint level of the vial, or there's any kind of wetness around this vial when you receive it, please contact the company with the information that's included on the front side of this packet to let them know, and then they can supply you with an additional vial. If anything is sent to the company that we have less of this liquid that's in here, they can't process the sample, and we want to make sure that you only have to collect this just the one time for this test kit. So it's important to do things right, of course. So with this vial here, you'll see when you have it with you, it might be difficult to see just kind of on the video here. There is a little bit of a spatula spoon type situation that's attached to the top of this vial, or the top of this lid rather. So what you'll do after you've had your bowel movement, you'll uncap this, and then you'll use that lid and the spatula to scoop the beginning or the first portion of the stool that came out, and drop that into the vial. The middle portion of the stool that came out, same thing, drop it into the vial, and then the last portion of the stool that came out, and then drop it into the vial. That will then displace this liquid in order to make room for that stool, and it will cause it to go a little bit higher towards that red line. We cannot go any higher than this red line because higher than this red line indicates that it's overfilled, and when things are overfilled in transport before it gets to the lab, it might explode, which we certainly don't want to have the lab have to deal with. So make sure that you're filling it just underneath this fill line. If the stool, for whatever reason, does creep up above that red line, make sure that using this spatula, take only the stool out, making sure that all the liquid is maintained within that vial, and then just dispose of that extra stool in there. Once you have collected those 3 sections of the stool and making sure that it's not overfilled, you'll twist this cap on very tightly. That's important because if it's loose, then it might leak, and we don't want to have to redo this test here. Making sure that you put your patient information with your name, your date of birth, the date and time that you collected it, as well as what the stool looked like. This first section here is more formed. It gets looser as it gets to the bottom right-hand corner, and finally that bottom right-hand corner is more of a liquid type diarrhea. After all of this is labeled, this is nice and twisted on tight, that one is completed. You will then take this white vial here. This one does not have any sort of liquid in it, but there is also that spatula in there. So you'll fill this up with stool from that same collection, doing the same beginning, middle, end of that stool and putting it into this vial, making sure that you don't fill it up past that red line. Same issue stands with potential overfilling and rupture of the contents in transport. You'll twist this cap on, label with your name, date of birth, date and time collected, as well as what the consistency was. Same legend, same thing as what we had with this one here. So more formed versus more liquid. You do not need to shake it because there's nothing in there to mix. You'll then make sure both these ones are nice and twisted on tight. There are 2 different specimen bags. This one here, we're gonna do the same thing for both, but I'll show you with this white one. We'll make sure to wrap with the paper towel that's included around this vial to potentially collect any sort of condensation that might leak out. We don't anticipate on any of the fluid leaking out, so we need to make sure that's nice and twisted tight. It'll go into the specimen bag just like so. Make sure all that air is out of it. And then do the same exact thing here with this yellow one. Of course, making sure everything's labeled nice and clearly, and it's nice and twisted on tight. These will then go into the freezer, and then the next day, what you'll do is you'll open up this box. You'll put this frozen ice pack that you had prepared from the day before, and put both of these samples just on here, just like that. You'll make sure that you had made a note here when the date the sample was collected, and then you'll slip this into this box just like so. Obviously the gloves and the remaining stool that you have from the day prior can be tossed out. You'll have this FedEx bag here with the prepaid billable stamp. You can take the adhesive back portion off, stick it onto the bag. You're welcome to put your return address if you'd like in the front box. The 2 section is where that is going. You'll take this box and slip it into this bag just like that. You'll close it and get all that air out of there, and then take off this piece of red tape type substance, and then you'll close it to make sure that it's nice and stuck. Then you can either contact FedEx for a pickup straight from your house, or even just drop it off at a FedEx location near you. Our office does not ship FedEx specimens from our practice here, so we do require patients to have ship it out through FedEx themselves. If you have any questions, please don't hesitate to reach out to our office or your provider.